Hello, today we will be presenting on just culture.
So, what is just culture? Just culture is a balanced system of partnership and accountability among all members of an organization, where healthcare organizations are responsible for creating safe systems and staff are accountable for their choices. In a just culture, both the organization and its people are held accountable while focusing on risks, system design, human behavior, and patient safety. The importance of just culture is that it encourages the reporting of errors and safety issues by ensuring a fair and transparent process for addressing mistakes, shifting the focus from individual blame to learning from system failures to improve patient safety. The aim of Just Culture is to promote continuous learning from previous mistakes and develop strategies for preventing future incidents and enhance patient safety by focusing on openness, repairing harm, and learning rather than blaming. Who's responsible for Just Culture? Well, leaders and managers bear the responsibility for proactively creating an environment that minimizes risks and near misses. Nursing managers and leaders are key partners to both nurses and healthcare organizations. They provide important oversight and advocacy to meet the mission of the profession, the organization, and the patient's desired outcomes. These managers and leaders are guided in practice by the Code of Ethics for Nurses with interpretive statements and the American Nurses Association scope and standards of practice for nurse administrators. The key principles of just culture include a balanced accountability. This is where individuals are accountable for behavior and decisions, but the focus is on understanding systemic factors as well. It encourages reporting, where learning oriented culture encourages reporting of safety incidents and hazards without fear of punitive responses. There's focus on the system, not blame. The goal after an incident is to understand what went wrong rather than who caused it. It also promotes learning. It identifies the root causes of mistakes and near misses and implements corrective actions. And there's also shared accountability. It's a collective approach where leaders are responsible for safe systems and employees are responsible for their choices and for reporting concerns. The benefits of just culture include increased trust and engagement, where employees feel empowered to voice concerns about defects and hazards, leading to a more trusting and engaged workforce. Uh, Also, there's improved patient safety. Preemptive identification of risks and systemic weakness helps to prevent harm to patients. Enhanced organizational performance. There's a culture of learning and continuous improvement leads to a safer operations and better performance. And some scientific evidence that supports the just culture is evidence-based leapfrog initiatives have having the greatest impact on preventative medical errors include implementing 4 evidence-based standards, computerized physician provider order entry, evidence based hospital referral, intensive care unit physician staffing, using National Quality Forum endorsed safe practices, and use of barcoding and using a national drug code to reduce the point of care medication errors.
A relevance to nursing leadership and management. So the first is modeling professional behavior. Nurse leaders set the tone by promoting respect, accountability, and empathy. This is according to Huston in 2023. So modeling professional behavior. In a just culture, nurse leaders model respect, accountability, and empathy by demonstrating fair and consistent responses to errors. When leaders openly acknowledge system issues, avoid public shaming, and instead coach staff in safe practices, they set a tone where accountability is balanced with compassion, and this behavior signals to the team that reporting mistakes leads to learning, not blame, but then strengthens psychological safety and trust. Second is policy and decision making. Managers create systems that encourage safety culture. For example, non punitive error reporting, Policy and decision making. Managers operationalize just culture by designing policies and decision making processes that differentiate between human error, at risk behavior, and reckless behavior. For example, instead of automatic punitive action for medication errors, policies might outline a clear decision tree to guide leaders in determining root causes and appropriate responses. This ensures that policies support staff who report errors while still upholding patient safety and accountability. The third is team building and collaboration. Leaders foster interprofessional communication, minimizing conflict and encouraging inclusion. So, team building and collaboration. And just culture thrives in an environment of open, non judgmental communication. Leaders who intentionally foster interprofessional collaboration, such as daily safety huddles, multidisciplinary debriefings after incidents, and inclusive problem solving, help minimize conflict and increase transparency. Staff feel empowered to speak up about near misses or unsafe conditions because they trust their team and leadership. The fourth is change management. Leadership drives culture shifts during transitions, for example, magnet designation, EBP, or evidence based practice implementation. So, for change management, during transitions like magnet designation, implementing evidence based practices, or adopting new technology, leaders can use just culture principles to maintain trust and engagement. This means involving staff in planning changes, explaining the rationale, acknowledging potential stressors, and encouraging reporting of system vulnerabilities as changes roll out. By responding to feedback constructively rather than punitively, leaders reinforce that safety and learning are priorities even amid change. So, continuing relevance to nursing leadership and management. First one is quality control and patient safety. Just culture underpins a true culture of safety. It encourages staff to report errors, near misses, and unsafe conditions without fear of punishment. Huston describes quality control as part of a manager's controlling function, which relies on accurate data. If staff are afraid to report incidents, leaders don't get the information they need to improve systems. In a just culture, leaders focus on learning from mistakes and fixing processes rather than blaming individuals, which ultimately improves patient safety. Second, ethics, advocacy, and legal issues. Responding to errors in a fair and transparent way is an ethical issue. Just culture embodies principles of justice, accountability, and respect. Leaders and managers must balance fairness to staff with their duty to protect patients and comply with laws and regulations. This means knowing when coaching is appropriate, when a system change is needed, and when serious misconduct must be addressed. This aligns with Huston's discussion of ethical and legal responsibilities in leadership. Third, leadership roles in creating organizational culture. Leaders don't just administer policies, they set the tone for the whole workplace. To create a just culture, leaders model openness, fairness, and empathy. They invite feedback, admit their own mistakes, and support staff who speak up. This matches Huston's points about motivating climates, effective communication, and staff socialization. When leaders show vulnerability and consistency, staff trust them and are more likely to report issues that improve safety. And last, change management. Moving from a punitive or fear based culture to a just culture is a form of planned change. Leaders have to anticipate resistance, set clear goals, involve staff at every level, and make increment changes to build trust. Huston's framework for planned change supports this process. By creating just culture as a deliberate long term shift, managers can embed psychological safety and continuous learning into daily practice.
Implementing just culture in the hospital and its relevance to the hospital culture. Just culture in a hospital in a healthcare environment is a framework or culture that seeks to balance accountability and learning. Key elements include share accountability, non punitive reporting, focus on systems, transparency and openness, fairness in response to incidents, and emotional safety. Just culture, the organization designs and maintains systems, processes for safety. Individuals are accountable for their actions, especially when they deviate from standards or engage in a reckless behavior. But honest mistakes are treated differently from negligent or intentionally harmful behavior. Non punitive reporting. Staff should feel safe reporting errors, near misses, or unsafe conditions without fear or unfair blame or retribution. The goal is to learn from what goes wrong. Implementing just culture into the hospital environment can be challenging. Potential challenges or tensions can arrive, and it's not simple. You have to distinguish between individual error or systematic faults, which can be complex. Sometimes legal or regulatory pressures push for assigning blame. Staff may fear adverse consequences even in just systems, reputation, discipline, licensure, even if the policy says otherwise. Leadership consistency. Leaders must be aligned at all levels. If mid or top management signals blame, the culture won't shift. Emotional aspects. Incidents after people emotionally. If investigation or responses are overly technical or insensitive, staff may feel mistrusted or demoralized. Resource constraints. To support reporting, investigation, remediation, training, etc., requires time, staffing, systems in shortage, or high pressure environments. That is hard.
Hi, in this slide we will be discussing Gene Watson's Corita processes and how they give us a framework to bring compassion and humanity into healthcare culture, and how they also align very closely with the idea of a just culture. Corita's number one is the practice of practicing loving kindness with self and others. In a just culture, this translates to showing compassion and fairness whenever errors occur, and instead of focusing on blame, leaders focus on modeling kindness and respect, which helps to create this sense of safety so that staff can continue to report any errors. Then we have Caritas number four, which is all about developing a helping, trusting relationship. This is about trust, and trust is the foundation of a just culture. Staff must be able to believe that whenever they report a mistake or a concern, leadership will respond fairly and consistently. This process emphasizes open communication and mutual support, which is very essential in building trust and for a just culture. We have Caritas number seven next, which is all about engaging in teaching, learning experiences. Just culture views mistakes as opportunities for learning and not punishment. Leaders and staff can use errors to strengthen evidence based practice, mentor each other, and continuously improve systems of care. Together, these Garita processes show us that kindness, trust, and shared learning are not just ideals, but practical strategies for building a just culture. Thank you.
Hello, so we just wanted to provide a case study to help you better engage and understand just culture in the healthcare setting. So at St. Anne's Medical Center, they've been struggling with high staff turnover and patient dissatisfaction on its medical surgical unit. Exit interviews revealed that many nurses felt unsupported, communication was poor, and mistakes were often met with blame rather than problem solving. Patient surveys showed concerns about long wait times, inconsistent communication about care, and a lack of compassion. So in this scenario, Maria is the new nurse manager. She joins the unit and she quickly notices nurses rarely speak up in rounds because they fear criticism. Staff from different disciplines, including nurses, physicians, and respiratory therapists, work independently. Burnout is high, and several nurses are considering leaving their positions. So after Maria encountered this at St. Anne's, she did take some action. These included introducing a no blame air reporting system to promote safety culture. She holds monthly team building meetings where staff can share concerns openly. She implements peer recognition boards to highlight acts of kindness and teamwork. She partners with the hospital's education department to provide evidence based practice workshops and professional development opportunities. Some of the Watson Caritas processes that we think aligned most with this action included Watson's number one, loving kindness. Maria models kindness in her daily interactions, recognizing each team member's worth. She also utilized Caritas number four, helping build trusting relationships. She builds trust by listening to staff's concerns without judgment. And the final Watson Caritas process is number seven, which is teaching and learning. She encourages professional growth throughout workshops and mentoring. The outcomes seen at St. Anne's after 6 months included staff turnover dropped by 25%. Nurses report higher job satisfaction and improved teamwork, and patient satisfaction scores improved, particularly in communication and overall care. Some questions that we challenge you to think about after reading and hearing this case study are: what specific cultural issues were harming the unit at St. Anne's? How did Maria's leadership style influence the culture of the unit? Which of the Watson-Caritas processes that we listed do you think was the most impactful here, and why? As well as, imagine you were a staff nurse on this unit. What change would have motivated you the most?
And this is the end of our presentation. Thank you for watching.